They called 6 on Your Side consumer reporter Don Dare to explain why running out of bandages is not an option here. And Don also reports that TennCare is fixing the problem, right?
That's right, Lori. The baby in this picture has lived with painful blisters ever since he was born. You know from experience that when a blister is covered with a bandage, the pain eases somewhat. Well, this little boy has EB, a disease that causes blisters. They're called butterfly children because their skin is said to be as fragile as a butterfly's wings. Ever so gently, Miranda Madden carefully places her baby on his changing table.
Grab him something to play with, Dad.
13-month-old Asa Madden has a rare skin disease, epidermolysis bullosa, or EB, a defect that causes blistering on his fragile skin. His mother says a hug, a touch, even a fall can result in blisters. To help promote healing and reduce infection, several times a day, Miranda carefully changes the special bandages around Asa's tiny legs and arms. Simultaneously, Kenneth prepares the new bandages that will cover the infected areas.
This is life as he knows it. He is very brave.
While the Maddens have insurance, it does not cover the critical supply of bandages and gauzes. TennCare's health plan covers that cost, which amounts to several $1,000s a month. Until last month, Kenneth says he had no trouble gaining approval when ordering these big bandages from a company called CareCentrix. They also approved special gauzes of different sizes that hold the bandages in place. But in February, the couple says TennCare's health plan started handling the approval process.
Prior to February, things were smooth for the first year of Asa's life.
Last month, it took weeks gaining approval from TennCare for the bandages and gauzes.
When I call, I get a runaround saying our order is in approval process, when it usually only takes 2 to 3 days.
We called TennCare every single day, explaining that we were getting low and then we were out.
At one point in February, Asa went without clean bandages for 2 days. The Maddens called their doctor, who sent an emergency supply. Miranda, ever so tenacious, was on the phone to TennCare's health plan.
We were also told to take our child to the hospital if we were to run out, rather than prioritizing the authorization.
Eventually, the critically needed supply did arrive last month, late. Regarding Asa's case, 6 on Your Side contacted TennCare. The state says it does not feel his case was handled with the level of care and attention we all expect. TennCare says its health provider, Blue Care, is currently offering additional education to their staff and supplier to prevent any future problems. But TennCare says it does not anticipate any further delays in Asa receiving medically necessary supplies. The couple is pleased with TennCare's response, which will be put to the test within the week when they reorder Asa's supply of bandages and gauzes.
Well, 2 new auto carrier companies from East Tennessee are under scrutiny tonight by state and federal investigators. They're brokers who arrange vehicles to be transported. Tonight, 6 on Your Side consumer investigator Don Dare talks with 2 customers and the people they did business with.
Every day across America, thousands of vehicles, used ones, are shipped by transport professionals because people relocate or buy cars in a different location. 2 new local companies include Titanium Transport, a broker, and Transport Relief, another broker from Pigeon Forge. This website even includes a picture of a truck, but we found out there is no truck.
Oh, it's nice. It's
Retired Army Master Sergeant Todd Morrell contracted with Transport Relief in February to move this 1964 pickup from Washington State to his home in Stafford, Virginia, an hour south of Washington. He paid a deposit by check. But the $925 quote on his contract shot up by $300 as the delivery date approached.
They lured me in with a low price and then consistently tried to get me to increase the amount that I would pay for the move.
Master Sergeant Morrell eventually hired another company to move his truck. He never got his non-refundable $200 deposit back.
Under garage.
Mary Moore hired Titanium Transport with a deposit through PayPal in January to pick up this 1970 Maverick in East Texas and move it to Hampstead, Maryland, where Mrs. Moore and her husband own a car repair business 30 miles west of Baltimore.
When I called, they said that they have their own trucks. They're not just brokers. They have their own vehicles.
Like any good business person, Mary has kept meticulous notes on her dealings with Titanium Transport. $400 was the guaranteed quote, according to this company document, to move the Maverick. But as moving day approached, the guaranteed quote wasn't so guaranteed.
My new bill of lading says $700, not $400.
Mary eventually canceled the contract and never got her non-refundable deposit back either. Todd Morrell tells a similar story about transport relief. As his truck was about to be picked up, he questioned an agent why the price had jumped from $900 to more than $1,200.
And she said, okay, let me look for another carrier. And this process just kept going on and on and on. And then as I started doing some research, found out that this unfortunately is a bait and switch move.
As Mr. Morrell researched transport relief on a State of Tennessee website, he discovered another name, Ownership Relief.
They told me to make my check payable to Ownership Relief, not Transport Relief. Well, I looked up Ownership Relief and I see.
What he sees when he clicks the tab under Ownership Relief is the name Titanium Transport, the same company Mrs. Moore dealt with, and the agent was William Soller. So all of these companies are related.
There's some type of affiliation.
The Department of Transportation here in Washington, D.C. monitors transport companies. We checked with the Federal Motor Carrier Safety Administration. Both Titanium Transport and Transport Relief of Pigeon Forge are registered as brokers. As a result, complaints can be filed with the Department of Transportation, which will investigate. This home at Pigeon Forge is the listed business address for the two companies. Hey, how are you? William Soller, or Billy, associated with Titanium Transport, greeted us, and so did Chris Heaton, the agent for Transport Relief. We asked why the price of Todd Morrell's contract went up so much.
The contract says that there is no guarantee of a transport will ever happen, and there's no guarantee on quotes. That's why we don't send people prices, we send them quotes.
No guarantee that a transport will happen? We checked Todd Morrell's contract. It shows no reference to that language. Soller and Heaton said 75% of their customers experience no trouble. The other 25%, they said, people like Mrs. Moore and Mr. Morrell, have problems that are out of the broker's control.
We're not here to rip anybody off, all right? I take pride
We've delivered
in helping
about
my
20,
clients.
dispatch about 20
You're
this
dealing
morning.
with two people that have major issues.
What would you say to people who want to deal with Titanium Transport or Transport Relief?
Don't, just run.
We checked with the Better Business Bureau. Grades for the two companies are Fs with over 3 dozen complaints. The trade website Transport Reviews is filled with a dozen or more not so flattering comments about the companies. Other dissatisfied customers have called us from across the country. We directed them to the Tennessee Consumer Affairs Department and to the Department of Transportation to file their complaints. They are the only government agencies with authority to take action. We have a link to their websites at WATE.com. The problem for this 27-year-old woman is she has no medical insurance. With multiple disabilities, she became eligible for Social Security disability a year ago, but under federal guidelines, she's on a waiting list for badly needed Medicare coverage.
Let me check your blood pressure, Tab.
In Tazewell, David Carter cares for his disabled neighbor, Tabitha Deaton. Before she lost her sight, Miss Deaton worked every day at a Claiborne County convenience store. As an insulin-dependent diabetic, she has only one functioning kidney, and because she can't afford enough medication, her diabetes is out of control. A daily log of her blood sugar shows the levels are high.
It makes my potassium go out of whack, and that basically will stop my heart pretty soon if I don't get it under control.
And you're afraid that might happen?
Yes.
Tabitha has distant cousins in Tazewell, but no immediate family to help pay bills. At the Claiborne County Hospital, she's accumulated a huge bill that likely will never be paid back.
I'm sorry.
Unemployed and with no health insurance, Miss Deaton qualified for Social Security disability last year. But under federal rules, there is a 2-year waiting period before she's eligible for Medicare insurance.
If she don't get some kind of Medicare or health coverage now, she will die. She will not make it till March of 2014. That's when her Medicare kicks in.
There are exceptions to the waiting list, but Tabitha doesn't qualify.
I'm afraid I'm not going to make it until next year. My kidney functions are so bad.
And your diabetes is out of control.
Yes.
Paying for the medication she needs takes half of her monthly $783 disability check. In Knoxville, Melissa Knight enrolled Miss Deaton in the Interfaith Health Clinic. It's a medical facility for low-income working people or the uninsured who qualify. Here, a patient pays 10%. The clinic picks up 90% of a bill. From her home in Tazewell, Tabitha travels 60 miles to Knoxville to visit the clinic and see specialists.
She's done everything we've asked her to do. She tries very hard to improve her health care, but yet it's still a struggle. She's sick. She's very sick.
Now, more help may be on the way for her. Here at the offices of the East Tennessee Human Resource Agency, Tabitha met with a Medicare advocate the other day who signed her up with a patient assistance program run by pharmaceutical companies that offer free medication to people who can't afford it. Because she's legally blind, Tabitha also filled out an application for TennCare, hoping that bridges the gap before her Medicare begins.
I just would like to live a normal life right now. Sorry.
She plans on hanging in there. Don Dare, 6 on your side.
For more than 20 years, there's been a federal law that requires equal access to public places for people with disabilities. The Americans with Disabilities Act serves a worthy cause, but there's no police force to make sure those requirements are followed. 6 on your side consumer reporter Don Dare talks with a disabled man who gets action, but his tactics left one restaurant manager with a bad taste in his mouth.
Mario Navarro offers authentic Mexican cooking at his restaurant in Farragut. He's been a popular chef at several Knoxville restaurants for a decade. He owns and operates Mexico Cantina, but he's worried about its future. In early January, he was sued for violations of the Americans with Disabilities Act, the ADA. The plaintiff is Michael McGrath, who has muscular dystrophy. He visited the restaurant in May of 2012 and claims he was denied safe and equal access. Mr. Navarro says people with disabilities use his restaurant daily. He says there's never been an ADA complaint in the 3 years his place has been open. But Michael McGrath says he had trouble navigating in the men's room during his visit.
When I got in there, I found out there was no accessible stall that I could fit into.
The stall in the men's room, he says, was too narrow to maneuver his chair. So Michael had to go to his car where he keeps an emergency urinal.
I had to leave and just go outside. There was no equal access.
What do you remember about Mr. McGrath?
No, I don't remember Mr. McGrath. I don't know who's this person, really.
He didn't come up to you?
No, never.
What did I say to the owner? I never actually talked to the owner.
Did you talk to any of his workers there?
About the accessibility? No, I did not.
Mario says if Mr. McGrath had talked first, he could have had the ADA deficiencies changed last year, like the ramp that leads to the restaurant entrance. It's too steep for a wheelchair. Or the 2 parking spaces that don't have adjacent access aisles. Mr. Navarro says the lawsuit is financially draining.
Really, I'm thinking better close my business for this. It's too much big situation for me.
Court filings show since 2009, Michael McGrath has sued half a dozen restaurants, both in Knoxville and Nashville, as well as Thompson Bowling Arena at the University of Tennessee. He's used the same attorney from Alabama who specializes in ADA cases.
I don't like to do it, but it's part of how the ADA is enforced.
Under the ADA, only people with disabilities can sue a business for equal access. You said you're not out for financial gain here.
Oh, no way. No, never. Now, it is true, the lawyers do get paid, but the plaintiff, no. I don't get any money at all. I'm not allowed to. It's against the law.
The Disability Resource Center in Knoxville has a team that checks restaurants for ADA violations. Director Lillian Birch showed us a survey of 24 ADA requirements used to help restaurants become compliant.
Well, we send them a letter to let them know what's wrong, and if they need assistance with us to help fix the issue, we will help them figure out what to do to fix the issue.
Michael McGrath believes the Resource Center's surveys are ineffective because he says there is little follow-up. At the Resource Center, 36 restaurants have been made aware of their deficiencies over the last 2 years. Mario Navarro is now working with an architect trying to resolve the ADA discrepancies, hoping the fixes are within his budget.
Yeah, I want the place to be accessible for other people that come after me.
With the ADA enacted in 1990, Michael McGrath says businesses should know the rules by now. Don Dare, 6 on your side.